by H&J Enterprises and Excel Health TT, the official supplements of the CPL.
Ladies and gentlemen, good evening and welcome to Ask the Doctor, your weekly prescription for truth, care and conversation. October has arrived with its mix of bright sunshine and sudden showers, a reminder that health, like weather, can change without warning. But here's the good news, you don't have to face those changes alone. Right here, every Thursday evening, we open the doors of medicine to you, live, unfiltered, and always for the people. And if you missed us live, don't worry, Encore presentations air on Friday at 11 a.m. and Saturday morning at 11:30, right here on CNC3. Don't forget to like our Ask the Doctor page, and we're streaming on Facebook and the CNC3 website. And don't forget, every Friday, you can also catch me in the Trinidad Guardian, where my Ask the Doctor column takes a deeper dive into the health issues shaping our lives. This evening, we'll bring you not just information, but inspiration. The Kiddies Capsule for the little ones, Medical Minds with leading specialists, and of course, the Open Forum with giveaways and trivia. So this is where knowledge meets fun. So grab your notebook, your cup of tea, or even your veggies. This is your time. Let's talk health, let's talk hope, and let's do it together as we start with the Doctor's Capsule. Now, the month of October is, of course, Breast Cancer Awareness Month. A major new study has found that women who miss their very first breast cancer screening have a 40% higher long-term risk of dying from the disease. The research was published in a British medical journal and involved more than 400,000 women in Sweden, tracked for 25 years. So it showed that women who skipped their first mammogram, so they recommend that you're screening from the age of 40, were more likely to miss later screenings. They were more likely to be diagnosed with advanced cancer and ultimately more likely to die from it. Experts say that the lesson is clear. Start screening at age 40, and keeping up with it every 2 years may be life-saving. The mammogram, perhaps an ultrasound of the breasts, remain gold standards, but women at higher risk may also benefit from genetic testing or even an MRI. And while breast self-exams are no substitute, know your body and report changes promptly. So this month of October, we want to remind a woman not to delay, because early detection means that you have a greater chance of survival. That's more than 99% of breast cancer is caught early, compared to with just 32% when it's diagnosed late. So risk factors may include if you started seeing your periods at an earlier age, a late onset of menopause, of course a family history of breast cancer. We spoke about some genetic changes that may be present. And if you never breastfed or never had children, consider having a chat with your doctor. But all women should be screened. We've seen that over the past 5 years with the pandemic, that screening for many of these common cancers were often shunted on the back burner. Further afield, have you ever noticed how one person's laughing fit may quickly spread through the entire room? And scientists are actually saying that laughter is contagious, just like yawning, I think. Humans are wired to pick upon each other's emotions, and it's a trait we share with many mammals. And it's not just fun. When you laugh, it strengthens social bonds, helps relieve stress, and even releases feel-good chemicals called endorphins. So in tough times, like now, it also works as a natural coping mechanism. So the next time you hear someone laughing, don't hold back. Join in. It's good medicine. Back in the 1950s, there was a British doctor, Philip Hugh Jones, working in Jamaica, and he noticed something strange. 13 of his patients with diabetes didn't fit into the usual categories of type 1 or type 2. They were young, they were thin and undernourished, but unlike the classic type 1 patients who do not produce insulin, they never developed a complication called ketoacidosis, and he called it type J diabetes for Jamaica. Now, 70 years later, researchers believe he was onto something. And this unusual form of diabetes is linked to lifelong malnutrition, and it's now being recognized globally as type 5 diabetes. So we talk about some types. So type 1, you have no insulin produced. Type 2 in the graphics, there is insulin resistance marked by fat around the tummy, hypertension, maybe high lipids, and of course an increased cardiovascular risk. Those persons may be older, and there is a genetic preponderance. However, people with type 5 may make some insulin, but not enough, because their pancreas was never fully developed. Standard treatment with high-dose insulin could actually be deadly in patients with type 5 diabetes. If they don't have enough food to eat, their blood sugars will plummet. And experts actually estimate as many as 25 million people, particularly in low-income countries, we're talking in the Caribbean, may be affected, and parts of Africa, India, and Southeast Asia. So the International Diabetes Federation has adopted this new name, and researchers are calling for the WHO to follow suit so that these patients may get the right diagnosis. So malnutrition-related diabetes, and of course the right treatment before it's too late. Kudos to the entire team, and Professor Michael Boyne, my friend from Jamaica, led that research. It was published in another well-known journal called The Lancet about type 5 diabetes. Now, what about pregnancy, paracetamol, and painful politics? Politicians have never been known for medical restraint, and in the United States, one has declared last week that pregnant women should tough it out rather than take paracetamol. They warn that use in pregnancy may be associated with autism. Now, the problem with pronouncements like those is that they're not just comedy for late-night hosts, but they land in the laps of real women with real pregnancies, facing real choices sometimes about pain, fever, and health. We're seeing a surge in viral illnesses, including COVID. And they make headlines, they trigger panic, and sow distrust, without nuance, without context, and of course without compassion. So paracetamol, which is also called acetaminophen in the United States, is one of the most widely used medications in the world. For decades, it has been considered safe in pregnancy because millions of women have relied on it for headaches, fever, body aches, when few other drugs can be taken without risk. In recent years, however, there have been some small studies that have raised questions. Some research has suggested a possible link between prolonged use of high doses of paracetamol in pregnancy and an increased risk of some developmental problems to the brain, including something which is shortened to ADHD, attention deficit hyperactivity disorder, or, controversially, that spectrum of autism. But this is the crucial point I want you to remember. If something is correlated, it does not mean that it is the cause, because these studies are limited, and there are many other factors you have to consider. Was the woman infected with some sort of virus or bacterium that may have increased the chance of brain issues in the fetus? Whether there are genetic abnormalities, stress, and even perhaps why the paracetamol was used in the first place. So sometimes it's difficult to separate signals from noise. And most of the major health bodies around the world, including the National Health Service or the NHS in the United Kingdom, have not changed their advice. Paracetamol remains the first-line treatment for pain or fever in pregnancy, provided, and this is important, it is used in the lowest effective dose and the shortest duration necessary. And I think women who would have carried children will know that 9 months can bring nausea, back pain, migraines, fevers, and sometimes very serious complications. To deny women safe relief is to treat them not as people, but as vessels, valued not just for partnerships, but also just merely for reproduction. And it's almost like telling women they're expected to suffer in silence for the supposed greater good. So pain in pregnancy has always been political. And in fact, in many cultures, still women are told that suffering is their lot. It's a necessary sacrifice for motherhood. And nothing could be further from the truth. Too often, pain is dismissed as an exaggeration or weakness. And the irony is, if you don't treat a fever in pregnancy, it's something that, of course, we would recommend paracetamol for. It is known to increase the chance of miscarriage, preterm labor, and developmental harm to the fetus. So when you're talking about autism spectrum disorder, it's a complex developmental condition, and there's no single cause. As we mentioned, genetics or environmental factors may contribute. But the science is still evolving, and we've seen this before. There was a discredited claim in the late 1990s that vaccines caused autism, the MMR in particular, and we know that that has been debunked. But there were devastating consequences because it caused lowered vaccination rates and fueled outbreaks of measles that continue to ravage parts of the US today. So what should we bear in mind? Paracetamol is still the safest pain reliever in pregnancy. You have to be careful if you're considering aspirin or non-steroidal anti-inflammatory drugs like ibuprofen. They're generally avoided, especially in later pregnancy due to risks to the fetus. So use matters. Occasional use for a headache or fever is not the same as long-term or high-dose use, because that will tend to carry risks and of course should be discussed with your doctor. Fever is dangerous. Do not tough it out. High maternal temperature is harmful to both mother and child. Talk to your doctor. I want to underscore that because every pregnancy is unique. Medical advice should come from healthcare professionals, not necessarily from campaign rallies. Women are not incubators. Women are not extras in political drama. They deserve autonomy, dignity, and accurate information. When you're pregnant, don't tough it out. Don't fall for slogans. Instead, trust the science, trust your doctors, and most of all, we will trust women. It's time for a short break, and when we return, there's so much more on Ask the Doctor. It's great to be back.
With the cold and flu lurking around every corner, keeping your immune system strong allows you to live the life that you want every day. Discover BioStrath Immune Health. BioStrath Immune Health is a unique plasmalized yeast product that enhances the absorption of essential micronutrients, ensuring that your body stays resilient. And now enriched with zinc, it is your go-to support for immunity. Staying vibrant and healthy just became a whole lot easier. BioStrath Immune Health. Get what you need naturally.
Fence Trinidad and Tobago, your #1 choice for furniture, electronics, appliances, and parts. With the best prices guaranteed, there's no better place to shop. From exercise equipment to garden supplies, general office furniture, and so much more. Fence has it all under one roof. Call us today at 650-FENS. That's 650-3367. Or visit us at 1 Union Road, Marabella. Fens of Trinidad and Tobago. Quality, value, and variety you can trust.
With the cold and flu lurking around every corner, keeping your immune system strong allows you to live the life that you want every day. Discover BioStrath Immune Health. BioStrath Immune Health is a unique plasmalized yeast product that enhances the absorption of essential micronutrients, ensuring that your body stays resilient. And now enriched with zinc, it is your go-to support for immunity. Staying vibrant and healthy just became a whole lot easier. BioStrath Immune Health. Get what you need naturally.
With God, comfort can replace pain. Peace can replace turmoil. Hope can replace sorrow. God loves you. God hears you. God speaks to you in your thoughts, in your heart, and through living prophets. Come, hear the words God has for you.
Ho, 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 ho. Start the season sweet with Jimmy Abood's annual Christmas and October sale. Get up to 60% off on curtains, sheet sets, floor mats, upholstery fabric, and more. Shop now at the last big sale of the year.
You can make your goals unfold, go get it. the help you need to succeed. With Rand Credit Union, you can believe that you can achieve. Big goals, small ones too. Rand Credit Union, we've got you. No more waiting, that won't do. Make someday today. One life, so make it good. Live the way you know you should. With Rand Credit Union, yes you could. Make someday today.
Live your best life today with Rand Credit Union.
Welcome back to CNC3's Ask the Doctor. We're live on Thursdays with a rerun on Friday at 11 a.m. or Saturday at 11:30 a.m. It's time for the dose of health made just for our little ones, where big questions get small, simple answers. From superheroes in scrubs to tiny tips that keep you strong, the Kiddies Capsule is all about helping children grow happy, healthy, and wise. So gather round, boys and girls, because your health adventure starts right here. Feel free to send videos of school-aged children discussing these health-related themes to Uncle Rajiv at 800-CNC3. Let's have a look at this evening's Kiddies Capsule.
One big sweet potato provides 400% of daily vitamins and needs for healthy skin and strong vision. I am Julia Powell and I am from London Village in the school, and this was your Kiddies Capsule for today.
Fight migraines naturally. Study finds diet high in omega-3 fatty acids can help reduce migraine headaches. My name is Jalen Joseph. I am from London Hindu School, and this is your Kiddies Capsule for today.
Your calf muscles are called second heart. They help pump blood back to your heart, especially from legs. My name is Tyrie Cape. I attend Lendor Village Hindu School, and this is your Kiddies Capsule. Goodbye.
Scientists say that the brain senses emotions in others without you even knowing it. I am Selena Seri Singh from Lendor Village Hindu School, and this was your Kiddies Capsule. Bye.
Hello, my name is Vincent and I attend Specialist Learning Center. Today I want to tell you why playing outside is super good for you. First of all, when you run, jump, or ride your bike, you are exercising. And that makes your heart, muscles, and bones stronger. Outdoors is like a giant chill-out zone for your mind. You feel happier, less stressed, and even absorb vitamin D from the sun. That is so important for your bones and immunity. When we play with friends, we learn teamwork. So next time you have free time, put down the screen and head outside. Your brain and body will thank you. That was your Kiddies Capsule. Have a great night.
Hi, my name is Naya and I attend Unrocks Prep. You know that having friends can actually help your body and brain? It's true. When you play with your friends, it makes happy chemicals in your mind. This helps you feel good and stress less, which is good. This can help you stay active by riding a bike. That's good for your heart and your muscles. So friends aren't just fun, they're healthy. This was your Kiddies Capsule. Have a good time. I hope you like the other Kiddies Capsule.
We certainly did. What a treasure trove of information from all the children this evening. It's time for a short break, and when we return, the Medical Minds segment awaits.
With God, comfort can replace pain. Peace can replace turmoil. Hope can replace sorrow. God loves you. God hears you. God speaks to you in your thoughts, in your heart, and through living prophets. Come, hear the words God has for you.
mega month-end savings is on at Passad the Food King. Get instant savings on Gala snack apples 10 for $20. Bananas just $5.99 per pound. Idaho potatoes 5 pounds now $19.99. Flavorite ice cream assorted 3.2 liters now $44.99. Imperial margarine 2 by 113.5 grams 3 boxes now $20. Swirl dishwashing liquid, fabric softener and liquid laundry detergent 5 liters 4 bottles now $100. Ibis all-purpose flour 2 kg 2 packs now $30. Chicken wings now only $10 per pound. Soft and pretty paper towel 3 pack 2 packs now $25. Santa Rosa chicken Vienna sausage 4 tins now $20. Lotus soya bean oil 3 liters now $49.99. Swiss tomato ketchup 750 ml 3 packs now $20. Sierra chicken franks 340 grams 3 packs now $25. Oba macaroni and spaghetti 300 grams 4 packs now $20. Fruit Cool Kids juice 200 ml 8 packs now $20. But hurry, these deals end October 6th or while stocks last.
Bushside, quality value, that's our way. The real Bushsides, we're here to stay. The Food King.
Things don't always go as expected. Be ready with Trinry for auto, home, business and group life. Call us at 800-TRIN or visit trinry.com today. Huge insurance premium. Pay your premiums bit by bit with FlexiPay from Trinry. For more manageable auto, home and commercial insurance payments, call us at 800-TRIN or visit trinry.com today. Trinry. Premier insurance coverage for less.
Welcome back to your number one show for news, views and interviews of all things medical. This evening we welcome a very special guest, a man whose name carries weight not just in India but across the entire world of endocrinology. Dr. Sanjay Kalra is a leading physician, researcher and teacher whose work has shaped practice on every continent, including mine. But what makes Dr. Kalra truly unique is not just the science, it's the style. He has a gift for taking complex ideas and breaking them down with warmth, clarity, and even a bit of fun. In fact, you'll hear him sprinkle in some of our very own Trini vocabulary this evening. Proof that medicine, like laughter, crosses borders. So join me as we line with one of endocrinology's finest minds, Dr. Sanjay Kalra, bringing global expertise and a touch of local flavor in this evening's Medical Minds.
Good day, friends. I am Dr. Sanjay Kalra from India, and I'm happy to be back with you. I do not live in Trinidad or Tobago, but I feel Ide Trini to the bone. Why Ide Trini to the bone? Because I'm inspired by Trinidad Tobago. The literature that comes out from there is ultimate. It's awesome. And one hero that we have from Trinidad, of course, apart from the cricketers, is V.S. Naipaul. Naipaul said that each word has weight. Every word that you use, every phrase, every sentence that you speak carries a weight. It has a life of its own. And that is true in treatment, in medicine as well. So let's talk today about vocabulary therapeutics. And keeping in style, the style of Trinidadian Creole, we'll say vocabo therapeutics or vocabulo therapeutics. Now, there are two aspects to vocabulary therapeutics. Therapeutics means treatment, how we treat ourselves, how we treat others. As a physician, use your words, use your vocabulary to treat the patient in front of you. Speak such that you love to be listened to, and listen such that you love to be spoken to by others. So use your ears as a stethoscope. Understand the pulse of the patient through what he or she is speaking. Listen to what they are saying in English or in Creole, but also listen to what they are saying in unspoken language, in their body language. If we can listen properly, if we can cultivate the art of listening, 90% of medicine will be done. because the patient will tell us their complaints, their concerns, their challenges, and will also point out the right way to cure. This can be done. We can understand the art of vocabulary therapeutics or listening by the ear if we cultivate two C's. One is competence and the other one, compassion. So as healthcare professionals, all of us who are listening to this broadcast, let's keep on working. Let's keep on cultivating our competence and our compassion. Let's learn the art of conversation with the community at large and with the person, with the citizen who comes to our clinic. This is one part of vocabulary therapeutics, but a more important part is yet to come. And let's speak about that. That is the power that we have on our own bodies. The power that we have on our own bodies through our mind. And the power that we have on our mind through our words. That is vocabulary therapeutics. Now, this term called neuro-linguistic programming, this was coined more than half a century ago. What the concept said was that if you can marshal your linguistic, that is your language, power, if you can choose your words, you can cultivate your words in such a way that they can influence your mind. Together, your language and your mind will be able to influence your programming. Programming means the actions that you do, our attitudes, our behaviors, and our choices, ABC. So let's repeat that again. If I focus on my words, I choose my words properly, that will influence my brain, my mind health, my mind style, not mindset, but mind style will influence my lifestyle. And my lifestyle will influence my life in general, not only the quantum, but also the quality of my life. Let's try to demonstrate now. Suppose I live with diabetes, I live with obesity, and I say, I cannot do, I will not do, I shall not do, I'm unable to do, I'm not allowed to do. All these carry a different weight, all these phrases. They carry a different meaning. Maybe I cannot eat healthy food because I do not know what healthy food is. Maybe I'm not able to get access to it. I shall not exercise because I'm not sure of the benefits of exercising. I will not exercise because I've decided that no matter what comes my way, I'm going to ruin my health. I'm not allowed to take medicines because my husband or wife perhaps doesn't understand the importance of modern medicines. Let's understand this and let's change it to, I can do. Why can I not do? I am capable of doing. I shall do. I will do. If we make this tiny change in our brain, that is vocabulary therapeutics. And to begin, we have to begin with our tongue. We have to begin with the spoken language. So if we live with diabetes or obesity or any other chronic disease, let's begin by affirming this. I can do, I shall do, I will do, and I am sure I will achieve good health. This is vocabulary therapeutics. So vocabotherapy, the Creole way. Let's practice ourselves. Let's teach our loved ones, our family, our friends. Let's teach everyone who we meet. And let's begin by cheering everyone up. Let's keep on listening to Ask the Doctor. Let's learn the power of words. And let's make ourselves healthy. So, I day healthy, I day happy, I day in harmony with the environment. 3 cheers and look forward to meeting you again. Jai Trinidad, Jai Tobago.
We say a special thank you to the delightful Dr. Sanjay Kalra, and it was marvelous how he was able to incorporate some of the Trini lingo, and I'm sure that he would be interested to know that the Oxford English Dictionary just a few days ago added some terms, some local words, including foods such as bus up shot, cuckoo, feeling hungry yet, and even saltfish to their lexicon. So words from the West Indies have actually started to find its way into the Oxford English Dictionary. Thank you for your love, support and service, Dr. Sanjay Kalra, all the way in India. And of course, our viewers would know that the West Indies team is engaged at present in a test match against that particular country. I think we know that that result is a foregone conclusion. It's time for a short break, and when we return, it's the giveaway segment with the compliments of Great Health Works.
What is BioStrath? BioStrath is a premium all-natural herbal nutritional supplement from Switzerland, available in tablet and liquid form. BioStrath is known to help improve physical and mental efficiency at work, at school, or at home, increase resistance to infections, and compensate for our less than ideal food choices. BioStrath can also help reduce fatigue and stress, strengthen and support the immune system, help to restore and maintain natural energy, increase vitality, and support recovery from illness and exercise. BioStrath is not just another multivitamin, but a general wellness elixir. Improve your overall health and well-being with BioStrath Premium Elixir for every age and every stage of life.
With God, comfort can replace pain. Peace can replace turmoil. Hope can replace sorrow. God loves you. God hears you. God speaks to you in your thoughts, in your heart, and through living prophets. Come, hear the words God has for you.
Mega month-end savings is on at Prasad the Food King. Get instant savings on Gala snack apples 10 for $20. Bananas just $5.99 per pound. Idaho potatoes 5 pounds now $19.99. Flavorite ice cream assorted 3.2 liters now $44.99. Imperial margarine 2 by 113.5 grams 3 boxes now $20. Swirl dishwashing liquid, fabric softener and liquid laundry detergent 5 liters 4 bottles now $100. Ibis all-purpose flour 2 kg 2 packs now $30. Chicken wings now only $10 per pound. Soft and pretty paper towel 3 pack 2 packs now $25. Santa Rosa chicken Vienna sausage 4 tins now $20. Lotus soybean oil 3 liters now $49.99. Swiss tomato ketchup 750 ml 3 packs now $20. Sierra chicken franks 340 grams 3 packs now $25. Oba macaroni and spaghetti 300 grams 4 packs now $20. Fruit Cool Kids juice 200 ml 8 packs now $20. But hurry, these deals end October 6th or while stocks last.
Bushside, quality value, that's our way. The real Bushsides, we're here to stay. The Food King.
Welcome back to CNC3's Ask the Doctor. We're live on Thursdays with a rerun on Friday at 11 a.m. or Saturday at 11:30 a.m. It's giveaway time with the kind compliments of Great Health Works and a special hello to Joseph Sandel and the rest of his team. So the numbers on the screen, and as a reminder that when you're patched into the studio, listen on your telephone rather than the TV set, because there is a delay that creates confusion. And our question this evening, once more, we're trying to be wordsmiths this evening. What medical device includes the Latin word for cloud, and its mechanism involves evaporating liquid medication into a mist for inhalation? So it's a medical device that includes the Latin word for cloud. It evaporates liquid medication into a mist for inhalation, and it's used first line in the treatment of certain respiratory disorders. So what device used at home or in a hospital setting? Good evening and welcome to Ask the Doctor.
Good evening.
Thank you for joining us, ma'am.
Oh gosh, I can't say it.
It's a tough one. It's a tough one. It's something used, and may I give you a hint? It's used in the management of asthma. So in asthmatic patients, if they're at home or if they have to go to hospital.
Oh God.
So it's part of the management. So they have on that mask, it's a mist, it's opening up those airways in asthma, and it's a device that can be used in both settings. So I know it's a bit of a tough one, but that Latin word for cloud as part of the prefix, and interestingly, they've started to name some of the variants for COVID after clouds. So some of the variants like stratus, we will speak a little bit about that, because please avoid those closed, crowded, close contact settings. If you get an infection, particularly if you're asthmatic, the symptoms are exacerbated. Good evening and welcome to our show.
Hi, good evening.
Thank you for joining us, ma'am. It's a pleasure to have you on. So what's our answer to the giveaway segment?
Is it nebulizer?
Congratulations, you're a winner. It is indeed nebulizer, so that term neb, of course, is from that Latin word for cloud. It's part of the term, and a nebulizer used to deliver a liquid drug and, of course, form that mist and inhaled into the airways to cause widening of those airways and indeed to help with symptoms such as a cough, chest tightness, and shortness of breath associated with asthma. So well done. Have you used some of these supplements before?
Actually, no, but I have been looking at the advertisement, so I'm interested to try it.
So it's the first time for everything, and thank you for being part of our Ask the Doctor family. Congratulations again. And stay on the line. We'd want to take some of your personal information off the air. So in terms of our previous winners, if you haven't heard yet from the sponsors, please hold on and we will ensure that you get that prize. And feel free to remind Rajiv, our producer, if you haven't heard in the next few weeks. So it's time for a short break, and then it's the open forum, because it's time for you to take center stage. Whether you're seeking advice or just want to share some insights, this is the open forum coming up next.
This country real backward. You can't even report crimes online. Actually, since 2020, you could report your crimes online. And it's fast, easy, and secure. Let me show you how to do it in just a few simple steps. First, visit our official website at www.ttps.gov.tt. Then, click on Report a Crime, located at the top right corner of the homepage. After which, choose the option that suits your concern. Report a crime or report a suspicious or abandoned vehicle. Next, read the disclaimer, then fill out the form giving all the required information about the incident. Finally, once all required information is entered accurately, click Submit to send your report directly to the TTPS. Once your report is submitted, our Operations Command Center will review it and send it to the relevant division, branch, or section for classification and follow-up action. And yes, police officers will respond or communicate with you for more information in order to properly assess and take the necessary action. So the next time you need to report a crime or a suspicious vehicle, you don't even have to leave your home. Report it online and help us make our communities safer.
Welcome back to the open forum of CNC3's Ask the Doctor. It's time for your questions and hopefully answers. The number's on the screen. And as a reminder, when you're patched into the studio, listen on your telephone rather than the TV set. And please allow me to extend birthday blessings to Cheryl St. John from Central Trinidad. She never misses an episode of her favorite program. And our first caller hails from Diego Martin. Good evening, and thank you for waiting.
Good evening, doctor.
Welcome, ma'am.
I'm being diagnosed with having severe vertigo. I've had CT scan, X-ray, and the usual tablets, but have had little relief.
Yes, ma'am.
And it's ongoing severe vertigo with my last diagnosis. What can I do?
Thank you very much for taking the time to call in, and it's an excellent question to open the batting because it's a common problem. For the sake of our viewers, sometimes vertigo may be central or peripheral, and when we're talking about these calcium deposits in the inner ear that become shifted out of place, that sensation of the room spinning, nausea, vomiting or sweating would be particularly distressing. And I can hear in your voice that you're battling the effects of vertigo. Sometimes, and I'm glad that you've had a scan of your brain, your doctor would just want to ensure that there isn't a central reason for it based on a clinical examination. Now, there are some drugs which are used in the management of vertigo, and if they are not working, they may be amended, a dose can be changed, and there are different classes of drugs too to see whether they may help. So have a chat with your primary care doctor. Consider referral to an ears, nose and throat specialist who may even want to consider doing an MRI scan if warranted. And I would want to emphasize this, all dizziness is not due to vertigo. So you'd also want to look for some of the other symptoms. Although you have been told and labeled vertigo, your doctors would also want to consider some of the other reasons. So people have this sensation of dizziness when it is not an equivalent term to vertigo. And there are some maneuvers that you may wish to Google when it comes to vertigo, and some people would use it at home. Particularly, there's a Hall Pike, which is used by the doctor, and there is another term called the Epley maneuver. That's E-P-L-E-Y. You'd want to search that on YouTube for perhaps trying to see if there is some improvement in symptoms. It's distressing, it's unpleasant. However, if it's benign, positional vertigo in which the symptoms are exacerbated by moving a head from side to side, perhaps if you're going in bed or bending to pick up something, benign positional paroxysmal vertigo, although unpleasant, would not be fatal. So there may be a need for further investigations, amendment to some of the regular drugs used in the management, and also to remember that although you've been labeled as having vertigo, it may not be the case, and there are some maneuvers that may assist with your symptoms. In this case, the Epley maneuver. And we're not attempting to make a diagnosis on the basis of a telephone call, just to nudge you in the right direction, particularly if you need a specialist consultation. Our next caller hails from Wallerfield. Good evening. Thank you for being part of our family.
Good night, Mr. Doctor.
Thank you.
I have a little concern.
Yes.
I was diagnosed with having multiple blood clots in my body. And unfortunately, since February, I've been using anticoagulant medication since then. Pradaxa and Xarelto as Xarelto. Yes. Those two. My question is, usually, how long do you use these medications for?
Yes.
Because, as I said, since February up until now, I'm still using them.
And multiple clots in various parts of the body, like the legs or lungs?
Leg, arm, and so on.
Yes. And thank you for taking the time.
Yes.
In terms of the length of time that you would be managed, now, Certain persons may have clots in various parts of the body, and if they occur in rare or uncommon sites, your doctor would also want to see if there is an underlying disorder that is increasing the blood viscosity, that is increasing your chance for having clots in the future. Sometimes, especially in the lungs, the term is pulmonary embolism. This can be fatal, and we know that if it's occurring spontaneously and what we call an unprovoked blood clot, there are certain special blood investigations. You should be seen by a specialist called a hematologist to determine if there are rare or genetic disorders that are making it more likely that you have clots. People who are on the pill, the contraceptive pill, younger persons may find that they have clots. People after viral illnesses, we saw it particularly since the start of COVID in 2020, got clots in abnormal or uncommon situations. So my thinking is, usually if it is the first clot, perhaps in the legs, and we know that it's following a surgery or it's some provoked intervention, we would recommend a treatment for perhaps 3 to 6 months. Now, if you're having recurrent blood clots, many doctors would recommend lifelong use of these anticoagulants. So I know that you're becoming quite versed in the lingo in terms of drugs, in terms of some of the newer medications, but the underlying cause is important. There are some uncommon blood tests that your doctor would want to consider, some rare clinical problems under the supervision of not just your internal medicine physician. You'd also want to look at the heart in terms of a scan. There are some blood investigations that a hematologist, so that's a specialty of clinical practice involved with blood and blood-forming tissues. The hematology clinic is something that you'd want to consider, whether at Mount Hope, and I know that there is a new hospital in Arima that'd be closer to you in Wallerfield. I wish you all the best. So long-term seems prudent, especially if you're getting multiple episodes of these clots. And in certain areas, these could be life-threatening. Our next caller hails from Princestown. Good evening and welcome to the Open Forum. Hello? Our next caller hails from Princestown. Good evening and welcome to the Open Forum.
Take off the volume of number 3.
Thank you for joining us on the show. Good evening, sir. Hello? Hello? Welcome to Ask the Doctor. Good evening.
I would like you to explain something about asthma and COPD. What is the difference?
Thank you very much, sir. It's an excellent question. I know it comes on the heel of our giveaway segment in terms of nebulizer. And the symptoms may be similar. Now, asthma is a chronic inflammatory disorder which affects the airways. The hallmark is inflammation, contraction of the smooth muscle in the airways, but there are also inflammatory changes. So persons may be given some of the medications, including oxygen, or the medication is administered via a nebulizer, and of course steroids. Those are hallmarks in the management of asthma. The symptoms range from cough, chest tightness, shortness of breath, and of course wheezing. Now, all that wheezes is not asthma. In persons with asthma, there is reversible obstruction of the airways. In COPD, and that is an acronym for the sake of our viewers, chronic obstructive pulmonary disease. Now, that may be linked to cigarette smoking or exposure to certain pollutants. Persons who have been exposed to job sites, which may cause chronic changes to the airways with COPD, they may have similar symptoms, and it's diagnosed usually in consultation with a respiratory physician called a pulmonologist, and there are certain lung function tests. Of course, we would usually send people who are wheezing in inverted commas to ensure that it is not one of those diagnoses. When we're talking COPD, someone who is thin, perhaps they would have had an x-ray of the chest, and there are changes. They use a term called emphysema, and those persons may lose weight, they're thin, they are called pink puffers, and they're admitted to hospital with those sort of features. Sometimes you may have another form of COPD called chronic bronchitis. You're coughing, short of breath, you're producing sputum or phlegm, and for perhaps more than 3 months. Those persons are at risk for heart failure. So there's stress on the heart, they may have swollen legs, fluid in the lungs, and administered, and they're managed in conjunction with a heart specialist. That term is chronic bronchitis. So the pink puffers or emphysema patients or the blue bloaters or chronic bronchitis individuals all fall under the umbrella of chronic obstructive pulmonary disease, or COPD. Now, the airway obstruction tends to be permanent. And with the management, sometimes the inhalers are similar. Of course, there are different forms of medication for COPD. I want to emphasize, particularly in the throes of viral illnesses, as we move into the flu season and we have persons with COVID, the world is a global village, there's a plethora of infections around. Both problems, asthma and COPD, are associated with an increased risk of complications, including pneumonia, lung failure, admissions to hospital, and even death. Consider getting an influenza vaccine, especially if you have a weakened immunity, if you're a pregnant patient, persons at extremes of age like children and the elderly, and if you're a healthcare worker, avail yourself for a free influenza vaccine. As we move into the winter of North America and Europe, we will see a surge in viral infections. So they're similar. The presentations may be similar. We usually see genetic risk in persons who have asthma. Sometimes they may have a runny nose. They may have persons in a family with sinus inflammation issues, or even skin rashes called eczema. So that is a separate issue called asthma. COPD, as we mentioned, usually seen in persons with smoking or exposure to air pollution, and both would be diagnosed with some investigations involving lung function testing by a respiratory physician. It's time for a short break, and when we return, more of your questions and answers on the Open Forum. Don't go anywhere.
In the ever-changing media landscape, we at Guardian Media strive always to put you, our viewers and readers, first.
We strive to uphold the time-honored tenets of responsible journalism.
For us, accuracy is key.
And in our reporting, we strive not only to be first, but fair,
impartial,
and to uphold journalistic integrity.
Above all, we are accountable to you, and we must respect the views of our audience. That is our solemn contract with you.
Keen attention to detail,
rigorous verification of facts,
use of credible sources, and sound editorial judgment.
Keep track of our editorial policies and guidelines, including our corrections policy, by logging on to www.guardian.co.tt for more.
Welcome back to the Open Forum of CNC3's Ask the Doctor. Good evening, and thank you for waiting. It's a pleasure to have you on the air. Shogunas is on the line. Hello.
Hello.
Welcome, sir. Go right ahead.
Doctor, is that you?
Thank you. Yes, sir. We're hearing you loud and clear, and you're on the air.
Okay, I am. My TV is muted.
Thank you for joining us.
I am a cancer patient.
Yes, sir.
It's a lower bowel. I had it removed.
Indeed.
And my after a year, my test, all the test shows that there's no cancer anymore.
Fantastic.
So, could that be possible, and can you give me a timeline in terms of survival?
Yes,
I'm
sir.
over 70 years old.
And you sound so much younger than
I enjoy your show.
Thank you, sir, for taking the time to call in. And wonderful news if you've been told by the specialist that you're cancer-free. And we are looking at the lower part of your bowel, and if I may, colorectal cancer is becoming one of the leading causes of this particular chronic disease. The follow-up is lifelong. Your doctors will still be considering, of course, a CT scan of your chest, your abdomen and pelvis to look for spread. Sometimes the cancer specialist or oncologist will even ponder the use of medications or chemotherapy to ensure that there is no remnant of the cancer. If it were in the early stages at diagnosis and the surgeon has sent the specimen for testing, there was no involvement of lymph nodes, the wall of the bowel, surgery may be curative and there may be no need for further management. Just follow-ups in terms of the colonoscopy from your gastroenterologist. Of course, we mentioned about the use of radiological testing such as CT. There's even a scan called a PET that some of the patients would be monitored during the follow-up. And there is even a blood investigation called CEA, and we are all looking for recurrence. The follow-up is lifelong, and if caught in the early stages, the 5-year survival rate is excellent, particularly. Of course, we weigh pros and cons. You're 70 years old, fit and active, no prior medical problems. The survival rate would be excellent versus somebody who is age 70 and battling other chronic diseases, are quite frail and bedbound. They, unfortunately, even if the cancer is treated, the mortality rate will be different. So one size doesn't fit all, but if it's stage 1 versus stage 4, one would expect the survival to be superb. Congratulations, continue your follow-up. We mentioned about some of the tests that you would be employed, and with a multidisciplinary team involving not just your family doctor, but a gastroenterologist, the surgeon perhaps may want to have a review intermittently, and of course your follow-up colonoscopies in conjunction with the oncologist or cancer doctor. I don't know if we have time for a final call. Good evening and welcome to Ask the Doctor.
Good evening.
Hello. Thank you for joining us. Good evening. It's the Open Forum. Hello.
Hello.
Yes, sir. Thank you for joining us on Ask the Doctor. Welcome.
Doctor?
Yes. Hello. We're hearing you loud and clear. Go on.
Do you hear me, Doctor?
Yes, indeed. Thank you for being part of our program.
I have COPD. What I do?
Yes.
Yes, COPD.
Yes, sir.
And people doesn't sleep.
Hello?
What is the treatment I'm supposed to take for that, doctor?
COPD?
Yeah.
Yes, sir. Thank you very much for taking the time to call in. So I know at times the call seemed to be a bit fuzzy. COPD, once more, there is some level of permanence when we're talking about obstruction to the airways. As we mentioned, the symptoms may be similar to asthma, such as cough, chest tightness, shortness of breath. The cornerstone when we're talking about COPD is to prevent admissions to hospital or an exacerbation of symptoms. If you smoke, you're advised to stop. Some persons who have very severe forms may require long-term oxygen. In conjunction with your chest physician, there will be various inhalers to help with inflammation of the airways and also with the obstruction or contraction. And please, we're looking to prevent infections that may trigger and cause admissions to hospital. So the watchword is prevention. That's an excellent question. And our final call is from Marabella. Thank you for waiting and good evening. Hello.
Hi, good night, doctor.
Welcome.
It's 2 questions I have for you. Do they have cortisone injection in Trinidad? Do you give it?
What sort of injection? I beg your pardon?
Cortisone injection.
Cortisone, yes. Thank you very much for taking the time.
Do you
Now,
give I'm not hearing you.
yes, ma'am. Listen on your TV set now.
Do you give cortisone injection?
Thank you for taking the time to call in. So Cortisone is a type of steroid injection. So that is the quintessential steroid, and it's used for inflammation. It is a hallmark in the management, interestingly, of asthma, COPD, and also for joint inflammation if you have certain skin rashes, and most doctors would be happy to administer that. However, it's a double-edged sword. We must be vigilant when you're considering the administration of steroids, particularly long-term use, because there may be suppressed immunity, increasing body weight if you take it for long periods or in very large doses. There may be changes to your blood sugar, blood pressure, your eyes. So while it's a brilliant anti-inflammatory, and in fact, versions of steroids saved lives in infections such as COVID, and they're employed, as we said, in respiratory, skin, and even joint issues. So steroids save lives. However, a double-edged sword. One has to be careful about large doses, and particularly for long periods of time. So steroid injections, the quintessential name is cortisone, and we have new variants which may last longer and certainly worthwhile for many patients. And I certainly administer it. Parting is such sweet sorrow. And our closing quote is from Leo Buscaglia, that motivational speaker and writer from the US. And too often we underestimate the power of a touch, a smile, and a kind word, all of which have the potential to turn a life around. Now that's interesting. Healing doesn't always come from grand gestures or medical breakthroughs. Sometimes it's a small human acts, a reassuring hand on a shoulder, a warm smile, or a few kind words that leave the deepest impact. These moments are free, they're effortless, and yet profoundly transformative. Every week reminds me that medicine is really about people. The questions you ask, the stories you share, and of course the trust you place in us. To my team behind the cameras, to Neela and baby Daniel who keep me grounded, and to all of you watching, thank you for letting me be part of your journey. And until next time, take care of your health, take care of each other, and may God's blessings light your way. We'll see you next week on Ask the Doctor.
Brought to you in part by Alive, by Nature's Way, distributed by H&J Enterprises, and